Well, Pfizer is planning to request emergency approval for its COVID booster shot in kids 5 to 11. The latest clinical trials suggest that it offers 6 times the amount of antibodies when given 6 months after the original 2 doses. This comes as the country is starting to see a spike in COVID cases thanks to the contagious BA.2 Omicron subvariant. Here in Indiana, cases are still way down from that surge a few months ago, but health leaders warn that this lull might not last long. Our National Verified team will look into whether the new COVID variant could be the most transmissible yet.
Viruses like COVID-19 mutate as they replicate. That's how we ended up with variants like Delta and Omicron. From there, each variant can have small differences that are still within the same family. These are called subvariants. Now, some Twitter users are expressing concern about a new subvariant called XE. So, let's verify. Is there a new COVID-19 subvariant called XE? Our sources are the World Health Organization, the Centers for Disease Control and Prevention, and the UK Health Security Agency. The XE variant was first detected in the UK in January. The WHO says it's a combination of 2 versions of Omicron, BA.1 and BA.2, and early data indicates it could be slightly more transmissible. However, the agency warns it's too early to make conclusions about its severity and how effective vaccines will be against it. So, yes, there is a new COVID-19 subvariant called XE. UK health officials say XE represents a tiny fraction of their cases. In the UK, there were less than 700 XE cases during the first 3 months of the year, compared to 250,000 COVID-19 cases of all variants in just the first full week of April. In the U.S., the CDC says it's only identified a small number of XE cases. With your Verify, I'm Brandon Lewis.
Well, the FDA just approved the first COVID breath test, which can spot chemical compounds linked to COVID infection in your breath and get your results in less than 3 minutes. Now, a study found it accurately identified positive cases more than 91% of the time, but a PCR test is still most recommended to confirm those results.